Good morning, everyone. So, one more thing I would like to add in relation to the other video I recorded about dentist production. If I have an associate and their billings are quite low in comparison to all other associates, and we had discussions and we offered every type of mentorship, and their numbers are very low. Sometimes I have to let them go, and I have to be very clear about that. And the same way you can deal with the associate as well. If I'm letting go an associate because their numbers are low, sometimes in their mindset they think I have like a certain financial drive and I'm letting them go because they're not meeting my financial targets, and for me it's all about money. But it's not the case. For me, if I have a dentist who's underperforming financially, that's a reflection that they also underperforming in their dentistry. They can do their most beautiful small fillings, they can do the most beautiful scale and cleans, checkups, they can be very thorough with their patients, but I can guarantee you 100% their patients are being deprived of more ideal treatment plans, which means their patients are getting very compromised treatment plans, and the more complex dentistry or the more complex requirements for the case are being ignored as their orthodontic needs are being ignored, their occlusion needs are being ignored. They are being offered a lot of large fillings that in some situations other options could be stronger and last longer. They could be not offered other options as well in terms of missing teeth. But why they are not getting those value treatments offered to them? I think it's being offered, but it's not being offered in the right way. And I think it always goes back to the mindset of the associate dentist. If I list the reason, it will be probably number one, lack of confidence. And sometimes you offer them all the possible mentorship, but you could also be not the right coach for them as a practice owner. And maybe another practice owner in another practice can deliver this information with a different style, and it might change their mindset. So it could be lack of confidence, that you couldn't get the confidence up. Again, it could be also lack of experience. Although you offer them mentorship and they did training, but they still they do not grasp the information really well to execute that. Whatever it is, it's a situation where you have an associate and in their room, in their role, their patients in the practice are not being offered the best dentistry that can be offered to them, or even if it's offered, it's not offered in a way that will make them interested in executing them, and you'll end up with patients just getting offered compromised dentistry, which is not satisfactory for the patients, and eventually it's not going to be satisfactory for the dentist as well. In those situations, if you can change their mindset, sometimes it's fair for you and for them to let them go, because they might go to another practice and thrive under different mentorship, or they might go to another practice where they are happy with compromised dentistry in the practice. What are the exceptions? When would you let an associate stay in your practice with low billings and also a situation where their patients are not being offered optimal treatment? I don't think of a lot of situations, unless they are in a role similar to like a hygienist or oral health therapist role, so they're happy not to grow in their dentistry, but you have to have very clear clarity in how they communicate with patients and how they can internally refer cases to other associates who are willing to provide this complex dentistry. And that can be hard sometimes. So I can't see a lot of situations unless you're completely desperate in a location where it's very hard to rehire, and you can have a system like a treatment coordinator who can manage or help those dentists who lack confidence to communicate with patients. I hope you find this information helpful. If you find it helpful, please make sure you like and share this content. If you subscribe to the channel as well, then I can provide you with more content that hopefully will be helpful for you. Thank you very much.